Peru has one of the highest rates of maternal mortality in the Western Hemisphere, more than 20 times higher than in the U.S. Among the mostly indigenous populations living in the Amazon jungle region of Ucayali, where INMED's Healthy Babies program is working, the death rate among pregnant women and new mothers is alarmingly high, more than twice that of Latin America as a whole. But even that figure may be underreporting the true toll of maternal deaths due to poor documentation in the healthcare system. Recently, health authorities in Peru have made encouraging progress in reducing the number of maternal deaths through campaigns to increase the number of births occurring in healthcare facilities rather than at home, where complications can quickly turn into emergencies. The most significant successes have been seen in urban and peri-urban areas where pregnant women have ready access to modern healthcare facilities. But many of the most at-risk women, those living in remote rural areas, have been left behind. When a mother dies, her infant is much more likely to also die without his mother's care and feeding. If the baby survives, the responsibility of child-rearing often falls on older siblings, who may have to leave school to fill the mother's caretaker or breadwinner roles. Lacking education, these children face a lifetime of poverty, perpetuating the same risk for poor health and birth outcomes in the next generation. Infant mortality rates in Peru are also among the highest in the Western Hemisphere, especially in the Healthy Babies Project region of Ucayali, where nearly 1 in 20 babies die before their first birthday. More than half of these deaths are among newborns who do not survive beyond their first month. The Ucayali region is on the central east coast of Peru, bordering Brazil, where the Amazon jungle spans the frontier between the two countries. Indigenous peoples represent a major portion of Ucayali's rural areas. Many of these families speak little or no Spanish. Across the region, nearly 1/3 of men and nearly half of women are illiterate, but literacy rates are much lower in rural areas. 2/3 of Spanish speakers complete primary school, but in some indigenous communities, only about 15% are likely to finish primary education. 2 out of 3 families in the region are classified as poor or extremely poor. 3 out of 4 families lack running water, and more than 1 in 3 children are chronically malnourished. Only 2 hospitals serve the population of more than 400,000 residents in an area slightly smaller than the state of Colorado. More limited health services are available at 11 health centers and 138 local health posts. Pucallpa, the capital of Ucayali, is a modern city but faces deep poverty. Even in this urban area, many families lack running water and sewage systems. Many roads are in major disrepair. Just outside the capital city, the urban landscape melts away into the Amazon forest. Some communities are accessible only by river, others only by dirt roads. The predominant form of transportation, other than small boats, is the mototaxi, looking like a cross between a motorcycle and a rickshaw. INMED is confronting the tragedy of preventable deaths and debilitating illness among pregnant women, new mothers, and their infants in Ucayali through the Healthy Babies program. Increasing access to and improving the quality of healthcare services is essential, along with helping mothers learn and apply healthy behaviors. Launched in 2006 through a child survival grant from the United States Agency for International Development, INMED's Healthy Babies program has forged strong partnerships with government and health officials at all levels, with community-based organizations, with the private sector, and with thousands of educators, volunteers, and families. Together, we are mobilizing resources and empowering communities to lead the way in saving the lives of their wives, mothers, sisters, and infant children. But why are so many mothers and babies dying? The greatest tragedy is that most of these deaths are preventable. Nearly every life lost can be attributed in part to one or more of 5 basic factors. First, lack of access. The nearest health facility may be days away. Second, a lack of adequately equipped health facilities. Many health posts are poorly equipped with medicines and supplies. Staff are often poorly trained and unprepared to handle emergencies. Third, lack of transportation. When the river floods or dirt roads are washed out, women in labor are forced to walk to the nearest health center, often through dangerous territories. Some don't make it in time, giving birth by the side of the road. Fourth, lack of communication. Many indigenous women speak no Spanish, leaving them unable to communicate with health personnel and leading to potentially fatal delays in treatment for women and infants in distress. Language and cultural barriers discourage indigenous women from giving birth at health centers. Instead, many choose to deliver with untrained attendants, following traditional birthing customs that can be dangerous. And fifth, lack of knowledge. Women often do not know health danger signs that indicate trouble in their pregnancies or with their infants. Education is key, and in remote areas where health centers are unavailable, volunteer community health workers play a critical role in reaching pregnant women and new mothers. INMED's Healthy Babies program is working to overcome all of these barriers. On the front lines are community health workers, local volunteers who serve as the vital link between women and life-saving health services and education. Dining for Women support will allow INMED to expand and train the core of dedicated health worker volunteers who will make a life or death difference in their communities. With quality training provided by INMED, the volunteer health workers, in partnership with the healthcare system and their communities, are prepared to overcome the 5 major root causes of maternal and infant deaths in the region. First, lack of access. Where women live far from health facilities, community health workers bring basic care and education directly to them. Community health workers also staff maternity waiting homes, small guest houses located next to birthing facilities, where women from remote areas can stay for the few weeks or days leading up to delivery, ensuring that they are close to the care they need when labor begins. Second, lack of adequately prepared health facilities. Both community health workers and medical professionals take part in INMED training on best practices for prenatal care, safe delivery, and newborn health. Third, lack of transportation. Community health workers serve on local boards tasked with developing emergency transportation plans to help pregnant women, new mothers, and infants who need urgent care reach a health facility. Fourth, lack of communication. All volunteer health workers are members of the local community. They speak the same language and share the same customs as the women they serve, ensuring communication and demonstrating respect for long-held traditional practices while encouraging the use of modern guidelines for safe pregnancies, delivery, and infant care. And fifth, lack of knowledge. Community health workers deliver vital education on preventative health and hygiene, prenatal care and nutrition, developing a birth plan, breastfeeding and weaning, immunization, and signs of health emergencies. This one-on-one education is supplemented community-wide by a series of radio messages on prenatal and infant health. Reinforcing the efforts of the community health workers on a broader scale, the Healthy Babies program also leads health campaigns targeted to the general population. Most notably, we have treated nearly 300,000 men, women, and children for infection with intestinal worms. These parasites are widespread in areas like Ucayali, where sanitation infrastructure is poor. A belly full of worms can have profoundly debilitating effects: malnutrition, diarrhea, stunted growth, intellectual delays, and even death. One small deworming pill quickly eliminates the worms for up to 6 months. Hand-washing campaigns educate community members about one of the single most important elements in reducing intestinal parasites, diarrhea, and other infectious diseases that can kill. Since 1986, INMED Partnerships for Children has built alliances with partners in more than 100 countries to rescue children from the immediate and irreversible harm of disease, hunger, abuse, neglect, or violence, and to prepare them to shape a brighter future for themselves and the next generation. Through a wide range of health, social, education, violence prevention, and community development programs, INMED is working to inspire hope, build self-reliance, and encourage community collaboration to sustain positive change. Together with our partners, like Dining for Women, we are transforming the future for hundreds of thousands of children, their families, and communities in Latin America, the Caribbean, Southern Africa, and the U.S. INMED's Healthy Babies program is saving lives, but we're not doing it alone. We count on committed partners such as Dining for Women to sustain and expand our work. Together, we are creating a brighter future for families in Peru's Amazon jungle. One mother, one baby at a time. Thank you for your support.